Hello, my name is Abidemi Ola, a student of Waldenu University. I'm making this video for my health assessment class. I'm in the FMP program. My volunteer here is Miss Patience. Prior to coming into the examination room, I got her vital signs, her weight, and her height. And her vision acuity was checked with the use of the Snelling test, and her vision is 20/20. I'm going to start off my assessment by looking at her from head to by inspecting her body from head to toe, focusing on the feet as well. So looking at her body, no rashes, no swelling is noted. Let me take off your shoes here. No discoloration or PVD is noted on the toes here. Okay, and then I'm going to move right along. Sanitizer. I'm going to be inspecting our head, starting the assessment with the inspection of the head at this point in time. The head is not cephalic, no swelling, no bulging noted, and it's well approximated. And I'm going to go ahead and check her lymph nodes, starting with the occipital lymph nodes on the back of the head. I'm moving right along to the preauricle. Are you experiencing any tenderness?
No.
Any pain?
No.
Okay. Moving on to the clavicle here. The posterior clavicle. Okay. All right. So we'll go ahead and move on to her ears over here to check to make sure it's within normal limits. Each ear, they're both symmetric. No drainage, no exudates noted at this point in time. No redness noted on the outside of the ear. And I'm going to use the otoscope to look inside of the ear. So looking at the inside of the ear, the auricle is well positioned and it's gray, and some sebum, slight sebum is noted in the inside of the ear. No redness noted, no exudate noted. The auricle is noted to be slightly gray, and sebum is noted as well. Okay. I'm gonna do a whispering test. I'm gonna whisper some words and numbers, some letters and alphabets, and can you repeat them after me?
3 easy.
On the other ear as well.
4 AF.
All right, thank you. Her hearing is within normal limits, and the tuning fork is what I'm going to use to check for the conduction of the bone. And this, I'm going to place this by your ear and on top of your head in 3 different locations. Can you tell me where you hear it the loudest? Where do you hear it the loudest?
At the top of my head.
The top of your head. I'm going to check the other ear as well. Where do you hear it the loudest?
At the top of my head.
Okay, so it's a 2-to-1 ratio bone conduction. Okay. All right, moving right along. On her face and looking at the eyes, the eyebrows are well approximated. The eyelashes, the hearing is well proportioned, and no exudate is noted. No redness on the eyes are noted at this time. I'm going to use my pen light to take a look at the conjunctiva. You haven't had pink eye. Okay, can you open up your eyes, please? Okay, the conjunctiva is pink, well orange. Okay. I'm going would check for her parlor to check if the eyes are reactive to light and round, and to check for accommodation. Okay, so parlor is present at this time. Okay. I'm going to check the optic disc at this time. So I'm going to shine this light into your eyes a little bit. It should not be uncomfortable. And I'm going to come a little closer in a moment, but I'll let you know when I do. The optic disc has a good color, no hemorrhage is noted. The cup and the contour are within normal limits. Okay, the disc is flat. The cup, the contour, and the color are within normal limits as well. No aneurysm, no degeneration is noted at this time as well. I'm checking for the peripheral vision at this time. Okay. Can you look at my nose, and you're gonna follow my fingers with your eyes without moving your head, okay? No nystagmus noted at this time. Okay, all right, I'm gonna put this, I'm gonna hold this. Look at this pen light, okay, and tell me when you see my fingers moving. So my fingers is gonna move, but it's not moving at time. Once it moves, let me know by just saying now, okay? Without moving your head.
No. 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 No.
Can you touch this finger of mine and touch it, and then touch the tip of your nose, and every time I move it, you touch it and touch the tip of your nose. This is to check for coordination. Touch the tip of your nose. Coordination is within good limits, and moving right along to the nose. The nose, there is no nasal flaring noted. It's well shaped, no exudate, no drainage noted at this time. We'll take a further look by looking into the nostrils. Okay, the mucosa is pink, no drainage noted. The septum is well approximated. Okay. Can you hold one of your nose reels and take a breath in? Okay. And switch to the other one, please. Do you have any trouble inhaling air?
No.
Okay. Do you feel like you're congested anywhere?
No.
Okay, good. So meaning the septum is well positioned and there's no deprivation of air going on. I'm going to move right along to your mouth at this time. Can you open up your mouth for me, please? Good. So the mucosa is nice and pink. No swelling noted. No redness. No sores noted. Okay, I'm gonna put this in your mouth, and you might gag for a moment, and I would definitely not advance the way you're gonna throw up. Okay. All right. The tonsils are absent. Did you have your tonsils taken out?
No. Maybe, I don't
As a
remember.
child, probably as a
Mhm.
child. Okay. All right. So that's good. I would go ahead and do. Can you close your eyes for me and tell me what you smell at this time?
I smell of alcohol.
Okay. Good. What about now?
Chocolate.
Chocolate. Awesome. Okay. So I'm gonna this item this little object has two sides to it. It has a sharp and a dull end to it. I'm going to use either side on you. So you please let me know what you feel, if it's sharp or if it's dull.
Sharp. 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 Dull.
Okay.
Dull.
Great. So checking for the thyroid. Checking for the thyroid, I'm going to ask her to take so I'm just going to ask her to drink this just to check for the thyroid placement. The thyroid is well positioned, no swelling or deviation is noted at this time. And at the same time, I'm checking for the tracheal placement, which is midline and well positioned. Thank you. Okay. All right, I'm going to check for your sinuses at this time just to make sure there is no. Have you had allergies in the past?
Seasonal
Allergies. Okay, so let me know if you have any tenderness around here. Do you feel any tenderness?
No.
Any pain?
No.
Any tenderness or pain?
No.
Okay. So I'm checking for your lymph nodes at this time as well. If I did that already. Okay. No swelling. Okay. All right. Moving right along to the chest area. I'm going to listen to her lung sound, starting with the anterior and then moving on to the posterior chest to listen for the for her lung sounds. Take a deep breath for me. The listening should be done without the shirt, but for the privacy purposes, it's going to be done with the shirt on. Take a deep breath. Okay, thank you. The rising and the falling of the chest is symmetrical, and she's not having any labored breathing at this time. I'm going to go ahead and place my hands on hers to percuse her lungs at this time as well. And at the same time, I'm checking for tactile fractals. You can rest it. I'm going to percuss the lungs as well, just to check for thoracic excursion at this time, starting with the front. Then on the back, and I'm going to start with the top, and then I'll move on to the bottom, checking for the measurement. With the measurement with my fingers, it approximates about 5 centimeters, which is within normal limits. All right, I'm moving right along to the cardiovascular system, starting off with the listening of the carotid artery and checking for jugular vein distension. S1, S2 noted, no bruise, no third, no murmurs noted at this time. And looking at it, there's no jugular vein distension at this time, and I'm going to listen to our heart sounds as well. Starting off with the aortic. The tricuspid.